When every minute counts, you need an expert partner by your side to guide you through a cardiac emergency with a simple, step-by-step process. Adaptive instructions and intelligent sensors keep you on track to deliver the therapy and bridge the gap until care arrives. Act quickly and confidently with Philips AEDs, your partner in the shared mission of helping to save lives. To begin, simply open the AED by pulling this lever down. The device will turn on automatically.
Begin by removing all clothing from the patient's chest. Cut clothing if needed.
Then, just follow the clear and calm voice instructions.
Look carefully at the pictures on the white adhesive pads. Peel one pad from the yellow plastic liner. Place pad exactly as shown in the picture. Press firmly to patient's bare skin.
The HeartStart HS1 walks you through the entire rescue process and lets you do it at your own pace. Once the pads are on the victim, the system itself will analyze the victim's heart rhythm and tell you when to deliver shock, if and only if the victim actually needs it.
Shock not advised. If needed, begin CPR.
And it even guides you through CPR. It's just that easy.
A cardiac emergency can happen anywhere. Be prepared with a simple technique known as compression-only CPR. You can learn it in minutes, it's easy to remember, and it can help save a life. If someone suddenly collapses, check the scene for safety. Then, check to see if the person responds to you using the shout, tap, shout technique. At the same time, check for breathing, life-threatening bleeding, or another life-threatening condition. Are you okay? Are you okay? If at any time you determine the person is experiencing a life-threatening emergency, call
108
and get the first aid kit and AED or tell someone to do so. Then, if they are unresponsive and not breathing or only gasping, begin compression-only CPR. First, ensure that the person is on their back on a firm, flat surface, such as the ground. If they are lying on a bed or couch, carefully move them to the floor. Next, kneel beside them like this with your knees near the person's body and spread about shoulder width apart. Place the heel of one hand in the center of their chest with your other hand on top. Now, interlace your fingers and make sure they are up off the chest. Then, position your body so that your shoulders are directly over your hands. Lock your elbows to keep your arms straight. This technique allows you to use your body weight to help compress the chest. You are now in the correct position to give compressions. When giving compressions, push hard and fast. Compress the chest to a depth of at least 2 inches and a rate of between 100 and 120 compressions per minute, or about 1 every half second. After each compression, let the chest return to its normal position. Watch as I demonstrate just a few chest compressions so you can see what they look like. 1 and 2 and 3 and 4 and 5 and 6 and 7 and 8 and 9 and 10. Finally, keep going. Continue giving compressions until you notice an obvious sign of life, like breathing, an AED is ready, a trained responder is available to take over compressions, EMS personnel arrive and begin their care of the person, you are alone and too tired to continue, or the scene becomes unsafe.